Lumbar spinal stenosis can be very frustrating. We know that you need to strengthen, stretch, do mobility exercises, improve nerve health, and those things should be at the foundation of your recovery. But unfortunately, how you do it with stenosis is just so different than every other condition out there. So you can't just rely on general strengthening tips or mobility tips. The general information isn't going to work for recovery now, but also prevention of future pain and discomfort. So today I'm going over the 5 things that I work with my clients to understand why those things are happening and what to do about it. So these 5 key aspects will help you not only recover now, but give you that edge in how to establish that perfect cocktail of mobility exercises and strengthening and nerve mobility to help you recover and feel better so you can stand and walk longer. So make sure you take some notes today. Not all of these could apply to you, but some of them definitely will. These are the things that my patients most likely don't understand when they're starting their recovery process for lumbar spinal stenosis. The challenges and solutions I'm about to go over are unique to lumbar spinal stenosis. And so if you have stenosis or you've been told you have lower back discomfort and nerve pain, this is going to be beneficial for you. But the first focus and the first aspect we want to go over is the problem with extension. I'm just going to put EXT here. And so when you're stretching and exercising and improving your core strength and doing all of these things, extension is going to be uncomfortable for you because it closes down on the spine. So our solution for that is doing flexion-based exercises, and what I call is flexion is your friend, and that we utilize flexion moments of the spine, to the bending over, the roundedness, to give you that edge, especially in the very beginning, to help you feel better now, but also apply it to everything that you're going to be doing in the future. And so our body tends to lean into flexion when you have spinal stenosis because it opens you up, and that's not a bad thing, but we're going to use that to our advantage to give you relief and promote recovery. But remember, spinal stenosis is more than just a space issue in your spine. Most of the time that you have stenosis, you are recognizing that you have a nerve issue as well. And so we have this concept that's called peripheralization. I don't know how to spell that very well, but anywho, peripheralization is that if you're doing an exercise and you're feeling back pain, that's okay. But if you're doing an exercise and you're feeling symptoms go down your leg, that is not okay. So that is related to peripheralization. It's going into the periphery, which could be glute, hamstring, calf, or even foot. And if any of your exercises are causing symptoms to move from your back into your glute or anywhere down your leg, that is a red flag. That is something that you should not do no matter what. And so you may have heard the term of neurogenic claudication or sciatica, and all of those things kind of fall into this rule of peripheralization, and that if those symptoms are moving down, you need to recognize that and stop. Now, that being said, if you're having back pain, so back pain is okay, and peripheralization is not. So symptoms in your back are to be expected because that's the area that we're trying to treat, but pain down the leg is not to be expected. So our first thing here is we're trying to open up the spine, and then as we're exercising and doing mobility exercises, we're going to be taking care of our leg and making sure that we're not having symptoms down the leg. Now back up to the extension portion here, I do have a video that I went over 5 great flexion-based exercises that I'll have pop up somewhere around here that will give you that edge that you're looking for, that I know and you should recognize as well, that are safe for you to do. Now, how you do it is just going to be dependent on your body, but I'm going to tell you exactly how it should feel, and that's what I do in that video. But when I'm working with my clients who have spinal stenosis, we're definitely not allowing any leg pain. So those are 2 big aspects that we tackle early on because they apply to everything we're going to do in the future. Let's move on to the third aspect. So the third thing we're going to talk about is tissue irritability or nerve irritability and when you're talking about stenosis. But before I move on, I wanted to talk about that peripheralization a little bit more, in that let me give you an example of when that may happen. So if you're trying to do an exercise, let's say one of the ones that I have in my video, which is the lunge. It's a great exercise for spinal stenosis because you're flexion and you're moving forward and you're strengthening your hips and spine at the same time. So it's a great exercise. That being said, sometimes when I work with my clients, they can only do 5 repetitions of the lunge before they start to feel more than glute discomfort or glute soreness from the exercise, but they're feeling hamstring pain or calf pain. Well, that's a sign of peripheralization because that's moving away and going into the periphery. So when that happens, let's say at rep 5, we stop. Then we go right into a flexion-based exercise. Maybe it's the forward fold, maybe it's the seated lumbar flexion stretch, but whatever that may be, we need to do to give you some relief so we're not forcing the peripheralization because that's the nerve telling you to stop. Back soreness is okay, but nerve pain is not okay. So over time, I would want to see this and expect that as you do exercise, you can do more of them before you start to have pain down the leg or pain moving away from the lower back. That's how we tell progress, but that's how we apply the peripheralization phenomenon throughout the entire recovery. So that's just one example of how I do that, but we use that with every exercise. And I know it's unique to each individual, but just try to keep that in your head as you're doing your exercises and your stretching and your mobility work. That being said, as you're doing those things, soreness is okay, but pain is not. And so soreness in your lower back is saying, hey, we're working that area. Pain is saying, whoa, you need to do something to relieve that discomfort. So the rules that I have with that is really, you can't go more than a 2 out of 10 of pain during the exercise. So if you're starting off at a 4, you can't go up to a 6. If you go up to a 6, you need to stop and do some sort of stretching technique to give you some relief. That also being said is you can't do an exercise that leaves you sore for 24 hours. And so in that same example of the patient that I'm doing the lunge, if they're doing the lunge, they go into that extra little pain down the leg, we do a stretch, but then let's say the next day they're paying for it or they're laid up because they did that exercise, then that was too much. That's called tissue irritability, and that your back and the tissues in your spine are not ready to handle that. So we need to downgrade that exercise by doing something a little bit easier, but we may increase the reps of that easier exercise to make sure that we're improving. So the tissue irritability is kind of a difficult concept to get at first, in that in the moment you're allowed to have soreness, but if you have pain, you need to stretch and relieve it. But how you feel that next day is really important. And when I work with my clients individually or I'm doing some consulting, I'm talking to them and figuring out, okay, how do we need to address your home program and figure out what you're doing and things to add that we need to control variables. Because if you're laid up for 2 days after we do a program or an exercise or so, then that's not good. We need to take it back a little bit. So if you're getting any sense here with spinal stenosis, if you want to feel better in the long term, you really need to start dialing all of these things in, because it's important for you. Because if you don't, you're going to think you're going to need surgery or other invasive measures when you actually don't. You just have to get smarter with it. So if you have any questions about the tissue irritability or the phenomenon related to that, leave them underneath the video and just ask them, because I think it's important to get those answered. But that's a good way to tell, okay, how's my back doing and how are my nerves doing? And so if I have that 2 out of 10 during the exercise, I need to stretch. But if I have an increase of a little bit of pain, that's okay. But if the next day I'm laid up and I can't move, then you did too much. That's just too much for you to handle. We need to dial it back a little bit. That's why I like to give you a variety of different exercises to pick from. So we've went over extension, we went over peripheralization, we've went over tissue irritability, which kind of tells you how much can you push and when do you need to pull back. But the other two things are really important as well, because these are aspects that people don't even think about. Okay, so this next one really separates personal training from physical therapy, in that when I have patients who are doing well, let's say we have found 5 exercises that do really well for them. Maybe it's from the video I talked about earlier. Then those 5 exercises are what they do for now. But most of the time, those 5 exercises are not going to be what they stick with forever. So the fourth problem with spinal stenosis is that you need to get really fancy and really dialed into progression. So you need to learn more exercises, you need to learn more of about how they treat you and how they treat your back and how they treat your spine and your nerves. But then you need to progress them over time. And so here's just a small example of that. When I work with progression, I guess if you've had physical therapy before, you've probably seen some sort of 2 sets of 10, that type of thing, for sets and reps. But over time, we're progressing this probably to more of 1 set of 20. And changing the dosage of the exercise is just one example of that. But you could add more exercises, you can take them away. And that's why the lunge is my favorite exercise, because it works so many body parts at once. But if you have too high level of an irritability and you can't tolerate the lunge, then we're going to separate every one of those muscles out until you're able to tolerate it. So the moral of the story is what you're doing now may work, but it may not work forever, and that your body changes over time, and so should your exercises. And so I have plenty of PDFs on my website or other videos that I've done, or even if you've looked at my book where I have an 8-week progression of stenosis exercises, you are allowed to cherry pick and pull things out and add things in as it tolerates to your body. But we need to be doing some sort of strengthening mobility work and nerve health And that's my last aspect that I'm talking about. And so the very last thing I want to talk about is what it actually takes to have long-term recovery for lumbar spinal stenosis. So before my lights go out on me, I want to go over this very last aspect, which is if you're looking to improve your overall pain and your resiliency in long-term and actually move towards long-term recovery for stenosis, you need to be doing more than just strengthening. And that's why I came up with the SPARK program. In that if you've read the book, great, but if you haven't, it may be worth checking out because the SPARK program goes over strengthening, pain relief measures, activating the nerve, regaining the mobility, and then addressing walking. And so if you have stenosis, you probably know that walking is definitely challenging, and there's a whole walking program that I have. But you're trying to work on mobility, you're trying to work on nerve health or nerve glides, you're trying to strengthen, and you're trying to find out exactly what works for your body. And that it's not traditional back pain, so it requires more than that. It's a nerve issue, so you need to do nerve health, and that over time you've also lost some space in your spine, which means you've lost range of motion. So we need to do strength, we need to do range of motion, we need to be doing nerve health exercise, we need to improve walking, and we need to do some pain relieving techniques along the way, which could include just stretching or massage or sleep positions or TENS, which I have gone over before. But the challenge with stenosis is that it's just not one thing. And the SPARK program breaks down every aspect that I have seen be the most challenge for stenosis, and then it's that well-rounded approach. And so if you're going for that well-rounded approach for stenosis, and making sure that you're addressing every aspect possible to give you the best chance of reducing your chances for surgery in the future or some sort of intervention that you don't want to have, the SPARK program will do that for you. It'll lay that out for you. And in my book, I go over 8 weeks of that. But I've also done a video in the past, which I'll have pop up here too, of exactly what that SPARK program entails and examples of each one of those. And so if you've gotten anything from today, it should be, you may feel a little confused. You may be a little bit frustrated or a little bit unsure about the future of everything that's included with spinal stenosis and that you should be thinking about along the way, but just break it down. Go by one at a time. Think about the exercise you're doing. Think about what you're feeling that exercise, and then make a note of what you felt like the next day. With stenosis, we always lean into reducing discomfort, but improving strength at the same time, improving mobility at the same time. And you can do it, but you just need to get smarter. And so you can go through every one of those and look at other videos and see how that applies to your current program, or you could check out the book and just look at every one of those and do some exercises that I have found to be successful with clients. But whatever you do, try to look at each one of those, and maybe there's just one missing link to your current program that's kind of separating your frustration to freedom, right? Feeling that relief in the future. So think about it, ask the questions. I think it's important to get those answered, but these are all things that I'm thinking about when I'm working with my clients. I'm like, okay, what are you doing that's extension focused that you shouldn't be doing? Are you having any pain down the leg? Are you doing too much too soon and your body just can't handle it? And then are you progressing it? It's like, yeah, this is a great program for you right now, but it may not be what you do in the future unless you've already met all your goals, which most people haven't. So we need to be progressing it. And then you need to understand that a well-rounded approach for spinal stenosis is best. And that in my experience, if you get these things down, you can really give yourself the best shot possible to recovery. So if you have any questions, please ask them underneath the video. Hope you got something out of today's video. I love the whiteboard. I love a little bit of learning. So if you guys have any questions, please leave them under the video. But until next time, stay healthy, keep moving, and take care of yourself.